Just in case, I'm going to do my NG tube check-off. My 12 safety practices are 1, verify client order, 2, perform hand hygiene, 3, verify policy and procedures and gather supplies, 4, consult for the manufacturer for any equipment, 5, I'm going to knock on the door, 6, I'm going to use 2 patient identifiers, 7, I'm going to note the overall appearance of my patient, 8, I'm going to explain the procedure and what I'm doing for them. I'm going to raise the bed for proper body mechanics. I'm then going to don PPE, and then I'm going to, when I'm done, lower the bed, put up the side rails according to care plan, and I'm going to put the call light within reach. And if I notice anything that looks off, I'm going to report that to the charge nurse. So I have an order for an NG tube for my patient here. So I'll, of course, perform hand hygiene. I'm going to come in. Hi, Mr. Mannequin. My name's Madison. I'm your nurse today. I got an order from your doctor to put in an NG tube. Can you tell me your name and date of birth? Okay, perfect. And do you have any allergies or anything? No? Okay, perfect. So I'm going to put on some gloves. I'm then going to assess my patient, do a full abdominal assessment, also asking them past surgical procedures that they've had, or anything that might contraindicate an NG tube. So I have everything prepared. I'm gonna look at the patency of their nares. So I'm gonna have them cover one side and then another and see which one is more patent. And it looks like their left is the more patent side. So over here, I have my NG tube, and I'm going to get some lubrication. And I'm gonna make sure that my patient is sitting up in the bed, but when I started, I'm going to explain to them that they'll have their head back at the beginning, and then as it gets to the back of their throat, they'll put their head forward, and then I'll give them a sip, they'll take a sip of water, which I've provided for them already. So I've lubricated the end of this, and well, before I do that, I'm going to measure. So I'm going to measure from the tip of his nose around his ear to his xiphoid process, and I'm going to mark that. Okay, Mr. Mannequin. I'm going to put in your NG tube now. So lean your head back. Perfect. Now can you lean forward and take a drink for me? Awesome. So I've got it in there. I'm going to tape it to their nose to secure it. And I'm also going to tape it or pin it to their shirt so it doesn't get yanked out. And then I put in their NG tube. I'm going to check if I'm in the stomach. Of course, I would have a chest x-ray to confirm, but I'm going to take my bulb syringe and I'm going to place it, and I'm going to aspirate, and I'm going to take a pH strip, check it. It's less than 5.5. I know I'm in the right place. And so now that I've finished that, I'm going to grab my suction and I would hook it up. This one doesn't actually hook. And then I would leave, doing hand hygiene, of course. I would document what type of tube I put in. I would document how my patient handled the procedure. And I would be done with this part. So then I saw that I had an order for a gastric lavage. So I would come in, knock on the door, two patient identifiers. Okay, I would put on gloves. I would assess my patient, an abdominal assessment. I would ask them if they're having any nausea, vomiting, anything like that. And then I would grab my bulb syringe and some normal saline. And I'm going to check the pH of their stomach to make sure that the NG tube is where it needs to be. So I would unhook them from suction. I would place my syringe. I would aspirate. And I've tested my pH, it's less than 5.5, perfect. So now I'm gonna do the gastric lavage. So I'm gonna stick my syringe in here, and I would put them on their left lateral side. They would be on their side at this point. So I'm gonna take the top of it off, and I'm going to clamp it, holding it 18 inches. And I'm gonna pour my saline. I'm gonna unclamp it and let it flow. Then I'm gonna hook my syringe back up, and I'm going to aspirate it. Looks like that's still kind of yucky looking, so I'm gonna Put my syringe back on. Clamp. Pour my saline. Let it go in. Looks like it's clear. So then I would hook my patient back up to suction. I would monitor them. I would make sure they don't have any issues. Then I would document how the procedure went, how they tolerated it, and then I would be finished. And then, so next, I have orders to do a gastric gavage. So I have over here my imaginary glucerna shake, and it also said 50 things of water, so I have that as well. So I'm going to come in, perform hand hygiene, knock on the door, of course, and then I'm going to identify my patient using 2 patient identifiers. Perfect. I'm going to do an abdominal assessment. Also, I'm going to make sure that my patient doesn't have any allergies, that they're not nauseous or vomiting. And then to check that placement of the NG tube, I'm going to get my syringe. I'll unhook them from suction. I'm going to test the pH of their stomach. And it's 5.5. I'm going to get that residual back and put it in their stomach. Now, I'm going to continue to feed them. So here I have 25 of water. I'm going to pour. Let it go in. Perfect. Now I'm going to take their glucerna shake, put it in, let it go. Perfect. And now I have 25 more of water. Perfect. So they've done their feeding. Now I'm going to document how they handled, how much I fed them, what type of shake they had, and then of course I would assess them afterwards to make sure that they tolerated it, and then I'm done.